2, 1. Greeting, this is Ron from the Encyclopedia team. It is with great pleasure we have Dr. David Berrigan joining us for this interview. Thank you for coming.
Ron, thanks so much. Nice to meet you. And I really appreciate the opportunity to share a bit about my background, research interests, and perspectives on the journal IJERPH. I'm a program director at the U.S. National Cancer Institute in the Division of Cancer Control and Population Sciences, housed in the Behavioral Research Program. Um, and then in the Health Behavior Research branch, lots of layers in the government. I focus on primary prevention of cancer via healthy weight, physical activity, diet, reduced alcohol use, and tobacco cessation. These factors are modifiable risk factors for cancer that are responsible in the United States for almost 50% of all cases of cancer. So we can make a major difference for cancer prevention by addressing these health behaviors. I've been here about 20 years and was really lucky to find a position that allows me to combine service in supporting research and promoting it, along with doing some research and mentorship of my own. So it's turned out to be a terrific slot for me. My background and training were originally in physiology, genetics, ecology, and prevention. So this gives me a multidisciplinary perspective on cancer prevention and has led me to strongly support a focus on multi-level and contextual factors that influence health behaviors. Um, I know the first question we discussed was a little bit about me. So for fun, I like bicycling. And this summer I flew to Seattle and rode my handmade Belenki bicycle all the way across the United States, taking about 3 months. I followed the Rails to Trails Conservancy's Great American Trail, and it was just a lifelong dream and an amazing trip.
Seems like we have found our next Tour de France participant. All right. So our next question is, let's move to the main focus of this interview. What makes you want to research on childhood obesity? And could you please provide a little bit more background on such topic?
Sure. Childhood obesity captured my interest in the early 2000s when I first came to the National Cancer Institute because we started seeing sharp increases in the prevalence of obesity in children in the United States. Later on, too, let me note that we began to see increases in obesity in children in many developed countries, the UK, Germany, and other places. So this is a significant global health issue. Obesity is a risk factor for many types of cancer, and weight loss interventions have proved difficult. Many of them are not terribly effective, and very often, with intensive coaching, you see weight loss, but then the weight is regained, within a few years after the intervention. So preventing obesity in youth seemed like a key element of cancer prevention. If we can stop people from gaining excess weight when they're young, they're much less likely to gain excess weight when they're older because the weight gain tracks through into adulthood. Under the leadership of Rachel Ballard here at NCI, Tracy Orleans at the Robert Wood Johnson Foundation, and many other NCI and CD staff, as well as U.S. Department of Agriculture collaborators, we organized, and I was heavily engaged and have been through today in NCORE, the National Collaborative on Childhood Obesity Research. NCORE has promoted better measurement and rigorous evaluation of programs and policies related to childhood obesity. And I think our major conclusion is that there's no magic bullet, no one strategy that can prevent obesity in children. Instead, communities and policymakers have to engage in multiple actions addressing diet, physical activity, and their environmental, neighborhood, and contextual influences. So NCORE is still active and has a rich set of really useful resources on its website, www.ncore.org. Um, and so I urge you to take a look at that website. And before the pandemic, there was some evidence of progress in diverse communities in the US, slowing or reversing the increase in prevalence of childhood obesity. But during the pandemic, weight gain in the United States seems to have increased in children. So we're at a challenging moment in the US where we face both increases in nutrition insecurity, so poverty, job loss, as well as increases in the prevalence of obesity related to the challenge of having a good diet under conditions of nutrition insecurity. But I think the government is attempting to mobilize public health action in this area. And for example, the White House has just announced a date, September 28th, for a summit addressing this crisis and what to do about it. This summit coming up shortly will be taped, but also available for remote viewing. So I urge you to take a look at that. And I can supply websites for the materials I recommend here via email or through the encyclopedia. Just let me know how you want to do that.
Obesity just seems like a global crisis, even here in China. So, my next question is, what is the interesting or innovative part about your research and findings? How is your work different from previous findings? Because from all I know, fast food makes you fat, but is there anything new?
Well, rather than, I haven't solved the problem of obesity with novel research findings, but a lot of my work has involved developing data sets and resources and tools to help researchers address um, the challenge of childhood obesity. So today, what I thought I'd do is share briefly about three aspects of that work that have created some resources for better measurement. So first, via NCORE, the National Collaborative, and with Janet Fulton from the Centers for Disease Control and many others, I helped lead the development of the Youth Compendium of Energy Expenditure. In this project, we updated and refined a database that contains energy expenditure levels for diverse activities in different age groups of children. This resource enhances capacity to evaluate and compare interventions to try to figure out what's working. Um, and the data elements are freely available online, and they've been translated into English, Spanish, and Chinese. So they're on the NCORE website and available for use worldwide in at least initially these three languages. Second, with Jill Reedy and others, many others at NCORE, we've developed a suite of tools aimed at improving measurement of diet, physical activity, and their environmental influences. These resources include a registry of over 1,500 validation studies, training manuals, instructional videos, a catalog of US surveillance systems, and many other resources for helping people learn to make better measurement. And it's through better measurements of these influences on obesity that we can have more rigorous evaluation of programs and policies to try to address the obesity epidemic. And last, for adults, with Chuck Matthews from NCI and some other collaborators, including Jonathan Gershuni from the University College London, I've been working on time use surveys. These are 24-hour recalls where you ask people to recreate and tell you what they did, in 5 or 10 minute intervals throughout yesterday. And this is an important way for measuring physical activity, sedentary behavior, and sleep, because it's an improvement over standardized survey questions where you say, on average, for how many minutes did you walk per day in the last month? That's really difficult to remember. But if I talk you through yesterday, I could say, well, yesterday, what were you doing at midnight? And you might respond, well, I was asleep. And I say, what time did you wake up? And that process can help you remember in great detail your day. And in that way, these 24-hour recalls can collect reliable and valid data about behavior. Um, so we have a tool that works on computers and phones that helps to allow you to collect these 24-hour recall data, process the data, and spit out summaries. So this freely available tool, and I'll send a link to the encyclopedia or people can contact me, we think is a powerful new approach to collecting data about behavior. We've mainly used it in adults, but other researchers have used similar tools in adolescents. I think it would probably 11 or 12-year-olds could use it, and we'd love to see some people try it out in children as well. So those three tools are things that I think have been, valuable pieces of work over the last decade that I've collaborated on to try to address obesity.
We're really appreciating the works that you do and the data that you collected. So, what do you think about the development of this research field, and what's your prediction?
Um, yeah, so continuing to focus on physical activity, I think measurement of activity continues to advance with better algorithms for extracting data from device-based measurement and new tools like Act 24 and like an explosion of accelerometer and GPS-based systems for collecting detailed data about the duration, type, and intensity of behavior. I also think that efforts to measure behavior over the whole 24-hour day are critically important. There's a lot of evidence emerging that you really need to know something about sleep, something about sedentary time, something about light activity and moderate and vigorous activity in order to really understand the relationship between what we do all day and our health outcomes, including obesity. Additionally, we know that social and environmental context matter. Where are you and who you're with is going to influence what your behaviors. Um, and So devices like GPS and survey instruments like 24-hour recalls can help measure these contextual variables. And I think a lot more work is needed on better measurement, not just of what people are doing, but where they're doing it to try to understand, targets for intervention or education. Um, Passive data collection from consumer electronics like smartphones should be exploited and used for research, but it's incredibly important not to neglect efforts to collect representative data so that you're sure you're covering the entire population. Because you can have a really big data, but if it's biased data, it doesn't matter how big your data set is, it's going to give you a biased answer. So you need nationally representative comparators to kind of ground truth all these emerging data streams. So in summary, I really want to see better measurement of behavior and its context simultaneously so we can better evaluate the effects of built, natural, economic, and social environments on physical activity, on diet, and on obesity to try to address this risk factor for cancer. Um, and these efforts need to be carried out in conjunction with continued work on individual level interventions where we help people one at a time to improve their health behaviors. The problem is when so many people say are overweight or smoking, it's prohibitively expensive and difficult to have an individual coach for each person. You'd need like half the population being coaches to help the other half. So I think we need a combination of environmental and group level changes along with access to interventions. And this sort of applies to childhood obesity generally, but I think this general kind of thinking of mixing up multi-level interventions applies to all different kinds of health behaviors. We need environmental interventions for tobacco, like anti-smoke, no smoking in restaurants, as well as programs like smokefree.gov that help individuals quit smoking. So it's that combination.
Thank you for your insightful thoughts. So, what appealed to you about the International Journal of Environmental Research and Public Health? What made you
Sure.
accept the position of editorial board member of this journal?
Yeah. So the International Journal, I joined about 5 years ago, um, and it appealed to me for a number of reasons. Now I'm the section editor of the Chronic Disease and Health Promotion, so I really do believe in the journal and have put a lot of time into it and published quite a bit of my own work in the journal as well. So I really support the efforts of the journal to promote science worldwide. I think the journal does a really good job in supporting dissemination of important data from low and middle income countries, as well as publishing, more and more leading research from the developed countries. People in England, the UK, Australia, all over Europe are using the journal widely. But I think the journal has invested a lot of energy in helping investigators from places from every country and that's just so important to get data out there, public health relevant data from diverse places. That's how we can promote environmental and public health worldwide. Second, um, I like the open access model because again, this can really help people from low and middle income countries where you don't have, massive university libraries in every town. but you do have internet access. So people at educational institutions with limited resources are able to access this science. Um, I also really support online journals. We don't need to cut down entire forests to publish this scientific work now. It can be available, you know, um, digitally. So together, those factors, as well as the energetic and assiduous staff, have made this journal, I think, a valuable part of the scientific publishing domain and a pleasure to work with.
That's a lot of kind words you mentioned about this journal. So, what is your vision for the future of this journal?
Well, I hope the journal can continue to grow its reputation as a solid element of the scientific publishing landscape, and I believe it can. Steady improvements in the journal impact factor are clearly part of this. It's had a very impressive increase in its impact factor in the last 3 or 4 years. This increase is arising because of careful work by the editors and continuing, to reject papers that are not of sufficient quality. Because I know the journal gets, you know, um, um, twice as many papers as it accepts approximately. But also, the journal has to take great care to adopt best practices in scientific publishing. We need to strive to make sure every paper gets solid and thoughtful peer review, and that those reviews are assessed carefully by a member of the editorial board. Um, the whole scientific publishing system is under intense pressure right now because of the enormous volume of papers that require careful review. And researchers, the volunteer peer reviewers, are also under a lot of pressure for their time because, time is money. And so right now, many journals are facing a lot of difficulty in finding adequate reviewers. So one thing I think the journal can do is by continuing to promote and support improvements in research from all the countries all across the world, we can expand the pool of thoughtful and qualified reviewers, people who have published themselves and who understand what a good, clear paper is. But I also hope that the journal can be at the forefront of figuring out how to increase its quality, maintain rapid publication, a plus of the journal, but still serve to maintain quality and to promote science worldwide in the face of just a period of intense challenge for scientific review right now. So I don't know the answer. I think the journal is trying really hard, and I know the whole scientific publishing landscape is trying really hard to grapple with this kind of changing and dynamic landscape. But that's what science is. It has to grow and change and adapt. So I'm looking forward to continuing to grow and learn with the journal.
Wish you and your fellow colleagues the best of luck on your future endeavors. And thank you again for joining us, Dr. Berrigan.
My pleasure. And please let me just add to people that listen to this interview, don't hesitate to Google me, send me an email, and I can share some resources or address questions if further questions arise about some of the topics I've brought up. Thanks very much.
Thank you.